Good afternoon. Thank you, Dr. McConnell, for that kind introduction, and thank you for everything you do to serve your communities and to help train the next generation of caregivers in America. It's great to be here in North Carolina and be with so many friends, so many of whom have made such important contributions to the American Hospital Association over the years. It's good to be with Phyllis Wingate, a former member of the AHA Board of Trustees. She's someone who has always been a strong advocate for quality improvement and for coverage expansion. And I also want to thank Joanne Anderson, your incoming chair, for her leadership not only of the NCHA, but also of the AHA section for small and rural hospitals. And you just saw a display of her great inspirational leadership that we're all going to be benefiting from. And speaking of leadership, under Bill Pulley's leadership, there is so much that you can be proud of right here at this association. Bill was a real pioneer among state associations in focusing on performance improvement. In some ways, he was focusing on it before it was cool to focus on it. And he enjoys the respect and the admiration among his colleagues across America for his leadership in this arena in particular. And the continuing success of the NCHA's Quality Center, that's now in its 12th year, is an outstanding resource for hospitals to improve quality, ensure evidence-based care, and to promote a culture of safety. And finally, I just want to recognize one particular other very special person who I consider not only to be a friend, but a mentor, and that's Ed McCauley, the former president of NCHA and president emeritus. Ed, it's just great to be with you today, and we appreciate all of the terrific leadership that you've provided, not only here in North Carolina, but at the national level as well for so many years. You are always a first-class partner, first-class professional, and real hospital statesman and a true gentleman. So, Ed, it's great to be with you. What motivates me is a picture I keep in my office. And it was taken on a clear blue day on September 11th, 2001. And it is of doctors, nurses, and administrators standing outside the emergency department of my local community hospital in Arlington, Virginia, which is kind of in the neighborhood. Gurneys ready to take care of the victims of the 9/11 attacks on the Pentagon, victims who never ever arrived, because as you may recall, there really were no survivors. We're always there. We're always ready to care. That's the nobility of our work. That's our responsibility. That's the promise we make to the public. It's what makes this field so special. Just think about this. One patient is admitted to a North Carolina hospital every 30 seconds. Every 4 minutes, a baby is born at one of your hospitals. Every minute, there is an outpatient surgery performed. And every 5 seconds, 3 more outpatient visits. That is a massive responsibility, but it is one that you don't have to shoulder alone, because that's why the AHA and the NCHA exist. And I'm here today to explain why our partnership is more essential than ever before. Now, you don't need me to tell you that times are changing. You don't need me to remind you that the past few years have brought transformation to our doorstep, the way our patients are covered, the way our services are reimbursed. Sometimes it feels like the very idea of what a hospital is even supposed to be is up for debate. And I'm not here to give you some hokey line about how the Chinese character for crisis is the same as this character as that for opportunity. Because I know full well that when a patient arrives at your door every 30 seconds, change could feel like a distraction. And it can be frustrating when it feels as if that change is coming from the outside, that it's being imposed. So I want to talk about how all of us, each and every hospital and every state hospital association can chart the best path forward. In terms of the big picture, there are two forces that are pushing structural shifts in what we do: chronic conditions and consumerism. Redefining the H means developing new approaches to address both of them. The first force is the increasing demand for and the increasing focus on chronic care management. Now again, this isn't the first time in our history that the predominant focus of the healthcare community has begun to shift. But today, the number of Americans with multiple chronic conditions is rapidly on the rise, 149 million people, and it's expected to increase to 171 million by 2030. Today, the most common healthcare conditions are hypertension, high cholesterol, heart disease, arthritis, diabetes, and many cancers have now become manageable diseases. Today, get this, spending on patients with multiple chronic conditions consumes 84% of all healthcare dollars throughout all settings. That's where the spend is. By 2040, 24% of all Medicare spending will be consumed by people suffering from Alzheimer's disease. Redefining the H means adjusting to this new reality of where most of the resources will be needed and consumed. And that work is already underway. And right now, hospitals at all levels are working to find new, more efficient ways to help patients with multiple chronic conditions take charge of their health and lead healthier, more productive lives. And AHA certainly stands with you as a partner in that work. The second force is more social and economic than strictly medical. And it's the rise of what many have called consumerism in healthcare. And this trend shows up in a lot of different ways. Already we face a world in which patients have more of a stake in financing their care. And that's because of high deductible plans and skinny coverage plans with higher out-of-pocket expenses. That's going to place increased pressure on issues related to price transparency, particularly as retail markets for healthcare emerge and mature. But it's not just a question of brute economics, it's also a matter of patient preference. Today's healthcare consumers do not like to wait for anything. You think about it, the greatest generation were kind of patient patients. The baby boom folks fashioned themselves as educated consumers. But our kids that live on the iPhones, they don't have the patience for any type of wait for anything. And why should they? No other aspect of modern life demands patience. So as we look to the future, people will look for same-day appointments, walk-in care, ED fast tracks, house calls or home visits, patient portals, and telehealth. Today's consumers want to be connected constantly and electronically. And redefining the H means meeting the challenge to move from episodic to continuous patient engagement. And just think about that for a second. Our tradition is really episodic engagement. The new world is continuous engagement. It means providing increased value to our patients and connecting them in a way that makes sense in a digital world. And we can't afford to see this as fluff or icing on the cake. It's essential to keeping our patients loyal to our organizations and our networks. And as we move toward different methods of population health, however you define it, That's the only way to ultimately really manage people's care and keep them connected and keep them well. And if we don't do it, someone else will most surely beat us to the punch. In this new economics of healthcare, we will be challenged like never before to demonstrate that healthcare is actually an investment, not just an expense, to patients who increasingly see themselves as purchasers of care. As we face these new challenges and seek to turn them into opportunities, the reality of redefining the H is that we are not at the same starting point among all of us. We are all moving at different speeds. We are all engaged in massive experimentation, but the simple truth is that the only thing we have to fear is standing still. As we look to the future, hospitals must be the Netflix, not the Blockbuster. We must be Amazon, not Borders. We must be Uber, not the taxi cab. And we certainly don't want to be Kodak, because no sector is so big and so traditional that it can't be disrupted. No matter what the future looks like, we will always be stronger together. And you heard Joanne talk about that. Our great strength, nationwide and at the state level, is our common agenda. And regardless of the pathway one takes at this intersection to the future, we all share the need to expand coverage. We share the need to break down legal and regulatory barriers so that hospitals and physicians can work more closely together in an integrated manner. We share the need to expand information sharing from telemedicine to electronic medical records. We share the need to address behavioral health challenges that remove barriers to accessing that care, that integrate mental health with physical care, that reduce the stigma of seeking services for this care, and that deal with the opioid crisis. No matter what pathway you may be pursuing, we share the need to support graduate medical education to train the next generation of physicians. We share the need to prevent any further erosion in Medicare and Medicaid funding. We share the need to ensure that the antitrust enforcement agencies provide vigorous review to the proposed mergers that would create 3 national insurance companies that would cover 44% of insured lives and have $345 billion in revenue. And while we recognize and appreciate the innovation and advances that are taking place in pharmaceutical research, we all share the need to hold drug companies accountable for arbitrary, unfair, and outrageous price increases that are the result of market manipulation. And we all share the need to address healthcare disparities and diversity. And let me just take a moment to put a spotlight on an effort that we've undertaken in this regard that's really, really important. It's called the 1-2-3 for Equity Pledge to eliminate healthcare disparities. This campaign is co-sponsored by the American College of Healthcare Executives, the Association of American Medical Colleges, the Catholic Healthcare Association, and America's Essential Hospitals. It works to ensure that where you live or how much money you make never determines the quality of care you receive. More than 1,000 hospitals have signed this pledge already. The North Carolina Hospital Association has endorsed this pledge, and over 20% of the hospitals in this state have signed up to support the effort. Today, I'm asking you and your hospital to join us as well. Please sign the pledge and take action over the next 12 months. We've made some progress since we launched this effort back in 2011, but we have a long way to go. You know, even as we redefine the H, we also need to recognize that the H will always be a beacon for any person who needs help. When a crisis hits, people don't run to a doc in a box or an imaging center in the local strip mall. They don't go to CVS or Walgreens. They don't go to their local insurance companies. They come to us, and they always will. The needs of our patients may be changing as chronic conditions grow. Their behavior may be shifting as the phenomenon of consumerism in healthcare accelerates. But what will never, ever change is that they need you.